Hello, everyone, and welcome to this audio podcast. This audio podcast as part of a Cortical Capacitor series or edition. This audio podcast as part of a MaxxaR Pathology. This audio podcast as part of a Storm Robotics production. In this audio podcast, a little bit around a sort of a patient-centric sort of example from a sort of patient-centric example around multidisciplinary team meetings from what had been referred to as the Mid-Atlantic Renal Coalition example. So the Mid-Atlantic Renal Coalition, or MARC, is or was one of 18 Medicare-funded organizations in the United States responsible for improving the quality of care delivered to patients with chronic kidney disease. MRAC is and was a non-funded organization specifically supporting the District of Columbia, Maryland, and Virginia, and West Virginia. The MRAC recognizes that success of efforts to empower patients, their families, and or caregivers is dependent on collaborations between patients and healthcare professionals. The driving force of this collaboration is or was at the facility level. Family and caregiver sort of interplay is patient centric, and for example, not just a tick box aspect. So centric care is not characterized by particular specific practice, but rather the values and attitudes that drive changes to improve practices involving patients, families, and caregivers in the care of patient means the interplay interplay in amongst the hearts and the minds of people with whom the MARC work and the patients for whom are cared for. The MRAC, the Mid-Atlantic Renal Coalition, introduced a multidisciplinary team meetings and implemented a sort of a focus or program as a means for health professionals and patients to interact and share knowledge as a means of support in clinical decision making. When where CKD or chronic kidney disease management involves patient experience through MDT meetings and sorry when CKD management involves patient experience through MDT meetings, and also considers the perspectives, patients become more active, more proactive in the management and health and thus health and healthcare outcomes improve. The MRAC MDT meetings thus allow or have allowed a sort of an opportunity for shared decision making, and the Centers for Medicare and Medicaid Services, or CMS, had tasked the District of Columbia, and Virginia, and West Virginia, a renal community to interact with patients, families, and caregivers in a more MDT or multidisciplinary team model of care involving patients. The MRAC works at community level, and was another good example of opening its doors to implementing a multidisciplinary team methodology. That draws this audio podcast to a close. This audio podcast as part of a Cortical Capacitor edition or series. This audio podcast as part of a MaxxaR Pathology. This audio podcast as part of a Storm Robotics production.